Why are people in wheelchairs being arrested for protesting in D.C.? The protest this week was against proposed cuts to Medicaid in the Big Beautiful Bill Act passed by the House in May that is now being reviewed by the Senate. The bill is huge and covers a wide variety of government policies that affect all of us. So what exactly is Medicaid? Medicaid is a joint federal and state program that offers health coverage to millions of low-income Americans. 72 million Americans are on Medicaid. That's 1 in 5 people, and 40% of them are children. The bill calls for $880 billion in cuts to Medicare and Medicaid. The Republicans are claiming that the cuts target fraud, waste, and abuse, but the nonpartisan Congressional Budget Office says that there's absolutely no way to make the cuts without reducing healthcare services provided. I want to address this comment that we received on another video that we did on the Medicaid cuts in the bill. This person claims that the overwhelming majority of Medicaid goes to illegal immigrants. This is not true. The only benefits illegal immigrants are eligible for is emergency services. So, if someone goes to a hospital with an emergency, like they are in labor or have been in a car accident, the hospital will treat them, and those services will be covered by Medicaid. We, as a society, decided not to let people die on the front lawn of a hospital, no matter what their immigration status. We do track the amount spent on these emergency services, and from 2017 to 2023, non-citizen immigrants accounted for $27 billion in emergency Medicaid, which is less than 1% of total Medicaid spending. That's a far cry from the $880 billion the bill wants to cut from the programs. It's important to note that we do have a federal office in place that investigates fraud in Medicare and Medicaid. The Office of the Inspector General, or OIG, they are the government watchdogs. And they actually have a really good track record. For every $1 of funding that they get, they're able to recover $11 in fraud, waste, and abuse. Which raises the question, if the goal of the bill is to reduce fraud, waste, and abuse, and not cut coverage for people who are eligible for benefits, why not fund the agency that is most effective at doing just that? And before you start commenting that we need to spend less, not more, watch our video on the tax cuts in the bill and who benefits from them. The Big Beautiful Bill Act still needs to be voted on by the Senate and will likely have some more changes in the future. Hopefully, some of these cuts to Medicaid will be addressed. This is just part of our series on what's in the Big Beautiful Bill Act. Subscribe for more.